setting up the new medical facility. Inshallah, if God wills, this is going to be a dawn of the new hope for the countless individuals and couples who dream to make their families. So this will be a great moment, great chance. I think I always believe. I think that journey of parenthood can be filled with the challenges and the uncertainties. तो इंदिरा IVF का रोल यहाँ से शुरू होता है फिर then मैं समझता हूँ कि जो है इंदिरा IVF being a long big on in expertise, challenges, compassion with the compassion. ये जो फील्ड में जो है जिस तरीके से आप लोग को एक्सपीरियंस है इंदिरा IVF ये चौथा या फिफ्थ सेंटर है ये मेरे ख्याल से ये इन हैदराबाद तो मैं समझता हूँ कि जो बिलीव दैट this is a place, Indira IVF is a place, IVF center is a place where the science meets the empathy. Technology is combined with the unwavering support. Most of the parents, most of the families, like their hopes of aspiring the parents are maybe much as well that they nurture can be nurtured with a great care and dedication. So ये तमाम चीज़ें हैं we expect from the IVF center. Because this new center, I believe that this will be more just a medical facility. Definitely, ये उम्मीद रखते हैं, ये expect करते हैं कि जो है it will be a sanctuary support, understanding, और empathy, emphasizing the patients more. ये तमाम चीज़ों की जो है ज़रूरत है आप लोगों के लिए और डेडिकेशन एक डॉक्टर्स के बिफोर आई गो डॉक्टर्स के लिए डेडिकेशन के लाइन्स बोलना चाहता हूँ कि जो है जैसे वी हैव बीन डिस्कसिंग विद द सीनियर द फाइनेस्ट डॉक्टर्स ऑफ दिस कंट्री है या हमारी स्टेट के हैं द मैडम सो एथिकल प्रैक्टिस जो है एम्फेसाइज करो इसमें अपनी डेली रूटीन डेली प्रैक्टिस में dedication of the doctors and the nurses and staff in Indira में जिस तरीके से you have been expanding the centers तो ऐसा लगा कि this is a truly commendable आपके डॉक्टर्स का आपके स्टाफ का आपके नर्सेस का और जहाँ पर compassion combined with their expertise और definitely जो भी abilities जो capable जो बना है मैं अपनी फन आर्ट मैं अपनी फन की बुलंदी से काम ले लूँगी मुझे मुकाम ना दो मैं खुद मुकाम ले लूँगी मैं I can won't give my status we can grab that fortunately we can grab the status तो मैं अपनी फन की बुलंदी से काम ले लूँगी तो wonderful thank you so much मैडम once again बहुत बहुत मुबारक हो खुदा मैडम आपको भी अच्छे से चलाइए God bless you all.
But he has very correctly put the perspective that we all definitely need to work to see that the hope and the wishes of the patients who come to you are fulfilled. We agree? Yes. Now what I've seen is in the country we have got an overcrowding of IVF centers. I was just inaugurating a center in Kompally about 10 days back and I thought this is the first center. So madam, I thought 6th center. So what we have seen is there is an overflow of IVF centers in the city and country, and that shows that the infertility is becoming a problem. With the advancing in all the technology, techniques and all, we find that the way couples used to find it extremely easy to get pregnant is becoming a far off dream, and people are finding it extremely difficult to conceive. It could be the male infertility, the female infertility, all this is all linked to the environmental changes. So many pollutants in the environment, in the food we eat, in the water we drink, everywhere these pollutants are having an effect. We have seen if you look at the male statistics, the semen count has gone down and WHO's new criteria has reduced the normal semen count. And we see it in the patients and all the boys, and because there are so many reasons, not only this environmental, even the technology or the cell phones and all the laptops and all exposure to all these rays is also causing all the changes. And everything, so many things, infections, everything. And not only that, now आजकल couples बच्चा नहीं पैदा करना चाह रहे, कुत्तों को और बिल्लियों को पालना चाह रहे. I've seen many of my doctors colleagues, unfortunately, they don't want to have babies. They don't want to get married. They're waiting till the late 30s. I find girls and boys come, "Oh, I'm only 32, I'm not ready." I said, yeah, you are not ready, but your body is already in the wrong side of
getting
lapsed. Exactly. So that is I think we need to convey the message, the social message to all the public also. So आप when you are discussing in the meeting public people, and also you have to tell them, physiology of the body is also important. They have to be the natural way, and then otherwise take the help. So I think this is a very big field, and the only requirement, and I wish here the not many people but ethical practice is the most important crux of any line of treatment, which I wish and hope all of you will continue. Nitish Mudia is a part of the ART law, and hopefully you all should imbibe.
Which Ajay Murthy sir thought many years ago was, there were a lot of infertile couples who were traveling long distances, and they are already stressed. Again, this all added up to that stress factor. So he actually started putting up the centers. Actually, if you see, the first OPD center was actually his idea, where he put in Delhi, where he actually started, followed by Pune. And there was a very good response that happened. Slowly over time, the L1, L2 concept was there quite many years ago, and that was his vision, where people have easy access to their treatment. That was the main thing. Today what has happened, yes, the rate of infertility has actually extremely increased. Previously we used to study that when anybody is trying for 1 year, 90% of them will conceive and only 10% might not be able. But now if you look into the statistics, out of every 10 couples, 6 are not able to conceive. So we can see that the rate of infertility has increased so much drastically. And yes, our environment is definitely one of contributing factor. Age factor, yes, definitely is there, because a lot of people think IVF is something that they have to do at the last. It is not the first priority. But no, there are certain conditions where IVF is the treatment. There are men who have Jesus convicts, no sperm count, waiting for 5 to 10 years to conceive naturally. But we know that even after 1 year also, if it is not happening, there is something they have to evaluate. Similarly, tubal factor. It doesn't mean that they have to wait for 5 to 10 years for some miracle. Actually, IVF is a miracle for them. So mainly, yes, IVF, or I would put it as infertility awareness is something that is actually required. And I can say that as a team and even as Indira IVF Hospital, we are creating awareness amongst the general public. Also, one of the importance of having the center here is the accessibility. There are patients who are here coming to Banjara Hills, they're traveling all the way. There was a frequent request that we need a center in Gachibowli area, Kondapur area. So considering all this factor, then this thing came forward. And as I was mentioning before also, madam, ethics is something which actually is a core pillar for us. And I can say, even at the inauguration, we have put patient rights and responsibilities right today itself, because that is the importance we give